Welcome to the second ARCS2020 educational video. In this section, we open the page on the application's homepage. Previously, in the first video, we took care of About, Quick Access Toolbar, System ARCS, Receive, and Preset. In this video, we're going to look at the patient directory and the analysis page. So if we click on the patient directory will open. It's much like any patient directory on any software. It's going to have the patient name, ID, all the information that you entered in the preset of the recorder. This data is saved at this location on the disk, in this case C drive. This is the path to the ECG data. If you want to search elsewhere, maybe in a folder, you can click here on this icon. It opens up a Windows window and you can look from there. Or you can click on this box. It opens up a larger window. So if you have some search criteria you want to set for looking for the data, you can do that just by entering it and then clicking on search. Additionally, on the side are some typical window functions such as open, close, delete, edit, those types of functions which all are detailed in the user manual. So to begin, let's click on, we'll call this patient Demo 3. When I double click on this, it will take us to the analysis page. If the data has already been processed, it will take you to the templates page. So we'll double click. In this case, it took us to the templates page. This data has been processed before. We can always reanalyze any data. So if we click on the analysis tab, we are to the analysis page, which is what we want to review now. You'll also note that the General tab has been replaced by the Quick Access Toolbar, and the functions on this section are all the icons on the top, which we have selected previously in the Quick Access Toolbar for ECG. The screen is divided into 4 sections. The top right is all the ECG data for this particular patient, beginning at 10:48 all the way down through the 24 hours or whatever amount of time it is, 96, 72. And you can scroll through it with your thumb ball, your roller ball, or your trackball. You can also use the scroll control on the right side. Very often, ECG tech will want to review the data. Sometimes it's artifact like at the beginning, because maybe the device had not yet been put on the patient. So you could start from a different point in time. So you just scroll down to where you want to start, and you come over here to the refresh button, and you click on that, and that'll reset the start time of where you're going to process, or where you're going to be looking at the data. Now in the upper left, you're looking at the 50th out of 100 beats. The software looks at that beat to determine a start point and the parameters going forward, using the parameters in the analysis options you already set up based on the first video, and these timing points that can be adjusted either in the middle section, the up-down arrows, or you can highlight it and change it, or you can grab these lines and you can move them back and forth wherever you want. I will say that almost all times the default parameters are correct. So as you get started with ARCS, just hit the reset, use the default parameters, and go from there. If you want to change them for some specific reason, you certainly can do that, and you can set up a protocol. You can also increase the amplitude of the signal or spread it out by clicking on speed or gain, and then using the plus and minus button here to change the presentation. In the bottom right are, in this case, 3 channels. If it was a 12-channel Holter, you would have 12 channels. In this case, you have 3 channels. The software automatically selects what it believes is the best channel for signal processing to call the primary channel, and then the secondary is the second best, and that's based on signal amplitude and signal fidelity or quality of the signal. If you want to change that selection, you can just right-click and on either one of these presentations here, and you can alternatively reselect it. But again, most of the time in this area, the software does a good job of choosing the parameters. If you, in our previous discussion, talked about starting the data late, perhaps if you want to start the processing at some later time, you can change that start time. Here it shows you start time. and which day and what time. You can change that with the arrows or just plug in the number, just highlighting it and changing it. If the signal amplitude is not sufficient, which what you're seeing on the screen now is acceptable, it should typically be 2 or 3 bars in amplitude to get good fidelity and good signal detection. If you want to change the gain to make it higher, you can. Here I'll slip it to 3 and you see how much larger the signal is. But in this case, a gain of 1 is appropriate. If you want to change analysis parameters, you click on the Analysis Options button, and that takes you to a page that will look familiar from our first video section. These are the analysis parameters. And in this case, if you pre-programmed for a certain position, a certain clinical situation, you can select, download it and select it from there. Or these are the default ones that you have installed based on your presetting. And you can change any of these on the fly as your clinical situation needs. Once you set that, you can say OK. At this point, you come back and you're ready to analyze the data. You simply click on Analyze. In this case, I told you the data was written before or analyzed before and it was saved. So it's going to ask you to want to rewrite it. And we wanted to, of course, so we say OK. So normally I can quote BIOX data, 24 hours, takes 15 to 20 seconds per 24 hours. And that's what it's doing right now, is pre-processing and analyzing. It comes back, it says analysis is finished, and you say OK. It will automatically then push you to the templates page. Unless the patient has AFib, it will push you to the AFib page next. But now we're at the templates page, we can begin evaluating the data for quality and classification of the beats. And we'll continue this on the next section.